Here's a history of psychiatric malpractices. Spinning therapy. Proposed by Joseph Mason Cox in the 18th century, spinning therapy involved rotating patients around a vertical axis in a specially designed chair, commonly known as the Cox's chair. He designed the chair for the hospital and obviously not in his office. Cox believed the therapy had both moral and ethical benefits for people with mental illness. The most consistent effects were dizziness, nausea, vomiting, and sometimes loss of bladder control. Cox also reported improvements in sleep quality. Rather than advancing psychology, the device ended up contributing more to a research on visual motion and balance. The therapy was eventually abandoned due to a lack of scientific evidence. Cox was one of the first qualified doctors in England to specialize in mental disorders, but too bad he was not one of the first disqualified doctors. Hydrotherapy. Popular in the 19th century, hydrotherapy used water at varying temperatures to calm or stimulate psychiatric patients. It was applied through baths, body wraps, and sprays, and was used to treat conditions like insomnia, agitation, and manic depressive psychosis. Some patients were kept in continuous baths for days at a time. The treatment was labor intensive and space heavy, so only a small number of patients at some asylums received it, and it was daily, often involuntary experience. Historical records unfortunately tell us little about how patients felt about it. To be honest, I'm glad I didn't discover waterboarding yet. Bromide therapy. Bromide gained attention in the mid 1860s for its anti-seizure effects, but its popularity faded quickly as its side effects became clear. This included mental slowing, apathy, a dull facial appearance, and acne-like skin rashes, which is known today as bromism or chronic bromide poisoning. At the time, there were no legal restrictions on sedative dosages, and bromides were freely available over the counter. A better alternative, phenobarbital, was proposed as early as 1912, but its availability was disrupted by World War I, which made it available until 1920s. Bromide therapy is still used today, but only for animals. Be sure to talk to a veterinarian for helping your animal. Insulin shock therapy. Developed in the late 1920s by Manfred Zackel, insulin shock therapy was one of the earliest treatments for schizophrenia. Patients were given increasing dosage of insulin until they fell into a coma, then revived with a concentrated glucose solution. Upon waking, some patients showed improved mental clarity. Zackel believed that insulin-induced coma might be able to treat mental illness. However, by the 1950s, the therapy was falling out of use. It required intensive monitoring, lacked solid evidence for safety or effectiveness, and was soon overshadowed by newly developed antipsychotic medications. Convulsion therapy. Convulsion therapy began in 1933 when Ladius von Medulla used camphor to induce seizures in psychiatric patients. In 1933, Ugo Sciletti and Lucio Bini refined the method by passing electrical currents through the client's forehead, an approach that quickly became routine despite significant ethical objections. Over time, the therapy was increasingly misused in psychiatric hospitals to control and subdue patients, sometimes without sedation or restraint. One of the famous public backlashes was the Ken Kelsey's 1962 novel, One Flew Over the Cuckoo's Nest. As better medication emerged, the practice was largely abandoned. Today, a modernized and heavily regulated version, electroconvulsive therapy, is used only as a last resort for patients who cannot take medication. Deep sleep therapy. Deep sleep therapy, which is distinct from modern therapeutic sleep practices, was rooted in the century old belief that sleep has healing properties. In the 19th century, drugs like opium and chloroform were used to induce sleep in patients. By the 1930s, this evolved into a practice of keeping patients in a drug induced coma for up to 2 weeks, with nurses waking them only for the basic needs. Complications were common and serious, including dehydration, pneumonia, and heart failure, and the sedative used, such as morphine, carried a high risk of death. Fortunately, the practice never became standard. Public pressure and media attention eventually held practitioners accountable, bringing this to an end. Lobotomy. The lobotomy began in 1891 when Swiss psychiatrist Gottlieb Burckhardt surgically removed portions of schizophrenic patients' brain to reduce agitation. The results were mixed. The medical community rejected the practice, and it faded for several decades. It was revived in the 1930s by Portuguese neurologist Antonio Egas Moniz and his colleague Ameda Lima. Despite poor documentation and inconsistent results, the two successfully promoted the procedure across Europe. In North America, neurologist Walter Freeman makes his transorbital approach, inserting an S-pick-like instrument through the eye sockets. Freeman performed the procedure without a sterile environment or surgical assistance, carrying out tens of thousands of lobotomies with wildly inconsistent outcomes. The backlash came swiftly after Moniz was awarded in the 1949 Nobel Prize, drawing intense global scrutiny to the procedure. Clopomazine, the first effective drug approved for schizophrenia, reached roughly 2 million patients in its first year on the market. Then lobotomy became obsolete almost overnight. A 1967 study found that 91% of lobotomy patients showed significant personality defects following the procedure. Conversion therapy. Sexual orientation change efforts, or SOCE, refers to a range of techniques used by professionals and non professionals alike with the goal of changing a person's sexual orientation. Methods has ranged from one-on-one counseling and group program to, in some cases, underground electroconvulsive treatment. The efforts were often grounded in the false belief that same-sex attraction was caused by bad parenting, trauma, or emotional deficits. The evidence is clear: sexual orientation cannot be reliably changed through intervention, and attempting to do so can cause significant harm, especially when people are coerced into attending. SOCE has been banned by law in Canada, Mexico, and several other countries. Conducting such practices on minors can result in criminal charges.